Alright, so now I'm going to demonstrate a piggyback, and I'm going to check that I have the correct medication, the correct dose, the correct route and frequency, and the correct patient. The doctor has ordered Rocephin, 1 gram Q8 hours. I would know the implications of this drug, the action, purpose, the dose, the side effects, the infusion time, and any contraindications. And if the patient had any allergies, I would be aware of that as well. I would also be aware if the patient had any pertinent lab data. Okay, so the doctor ordered for Rocephin, 1 gram Q8 hours, and on my medication vial it says that it is 500 milligrams per milliliter, so that's going to be 2 milliliters. Okay, and I'm going to find my drop rate, and the drop rate is 10, and the doctor has ordered for this to run for 30 minutes, so that's going to be That's going to be 67 drops per minute.
Hey.
Hi.
My phone. I ain't go that far. I just went up this way. No worries, no worries.
How many drops per minute?
That's going to be 67 drops per minute. Okay, so now I'm going to drop my medication. Just going to clean this port. It's going to be 2 milliliters. Okay. I'm going to get my medication bag. Just going to clean the port. To inject my medication. Okay, and that goes in the sharps, and I would gently rotate the bag. Okay. Now I'm going to spike my tubing. I'm going to apply a new needleless device and prime my tubing. Okay, tubing is primed. I'm just going to keep this in a bag to keep it clean before we go in. Okay, so now I have my medication. I'm going to label. And I'm going to label the client's name, the drug, dosage, time, and my initials. I'm also going to label my tubing with my initials, the time, and the date. So now I'm ready to go into my patient's room. Hi, Miss Jones, how are you?
Fine.
Okay, so the doctor ordered for you to get Rocephin. Have you had this medication before?
Yes.
And can I get your full name and date of birth?
Rebecca Jones, 5167.
Okay, great. Do you have any allergies?
Nope.
Okay, so now I'm just going to check your IV site. I'm going to wash my hands. I'm applying my clean gloves. And I'm just going to check for any phlebitis or infiltration. Infiltration would be paleness, wetness, leakage, or coldness. And the phlebitis would be redness, edema, pain, or heat. And everything looks good. Okay, so I'm just going to close the clamp. going to hang your secondary medication. Okay. Going to lower the primary. Okay. I'm just going to clamp the primary, and I'm going to clean the port of the primary and attach the needleless device. Okay, and I'm unclamping the INT, and I'm going to establish my drop rate. Just going to squeeze my chamber. Okay, and my drop rate is going to be 67, so I'm just going to wait and count until I get 67. Okay, so that looks good. Alright, and I would just continue to watch the IV site for any phlebitis or infiltration. How do you feel, Ms. Jones?
Fine.
Okay, and I'll be back to check on you. Okay, so now I'm back and Ms. Jones' medication is finished. So I'm going to wash my hands and apply my clean gloves. And I'm checking my IV site for any phlebitis or infiltration. And the IV site looks good. So I'm just going to clamp this really quickly. I'm going to remove the needleless device from the piggyback. And I'm going to add a new needleless device for the next shift. And I'm going to unclamp my tubing and establish my flow rate once again, which was 42. Okay, and I would wait until I saw that. That looks good. Okay, so I've disposed of all my needles and syringes, and now I'm going to document the use of my MAR, the I's and O's, the condition inside of the IV, the medication used, the dosage, the time, and the drug, and the routes that I used. And that is all, correct?